Brampton remains one of the hardest hit cities in the country, with record-breaking positivity rates and widespread outbreaks in workplaces. Mayor Patrick Brown says it has been a difficult year as the city faces unique challenges in the fight against the virus. We speak with him in a one-on-one year-end interview. In a city where the majority of the workforce is considered essential, the mayor says lockdowns aren't as effective. In Peel Region, transmission isn't happening in restaurants or small businesses. With more than 140 workplace outbreaks, it's industrial settings causing the spread.
I know there's some companies that have had hundreds, in one case 400 cases, and so that's where the challenge is.
While dangerous, the work is necessary to keep the country up and running.
If Brampton wasn't working, Canada's supply chain would be in tatters. People from coast to coast can go to the grocery store, they can order goods on Amazon because of these unsung pandemic heroes.
And the tools needed to help those pandemic heroes are still missing. The mayor says he has been pushing higher levels of government for isolation centers, paid sick days, more testing, and more workplace inspections. I
find the only time we really get the attention of senior levels of government is when we're on the front pages of the newspapers or on the evening news. And I wish it didn't take that. Government moves at the pace of a snail, and that's frustrating. While
the city has received 70 new public health workers from the province and new testing sites, Brown says those measures don't go far enough.
I'm still frustrated that we don't have an isolation center in Northeast Brampton that has one of the highest positivity rates in the country.
And paid sick days. People working for temp agencies in warehouses and industrial settings are going to work with symptoms.
Here we are 9 months into the pandemic, and it makes me pull my hair out that our most vulnerable workers, as a country, we failed to take care of.
Brampton's many multi-generational families have also enabled household spread to happen at a more rapid pace. On top of that, the city is coping with decades-long problems, what the mayor calls a historic underfunding of healthcare.
While in Brampton, our hospital's been at capacity for years. For years before COVID, we were at capacity.
The provincial average for hospital beds is 2.19 per 1,000 residents. In Brampton, that number drops to 0.96.
So we have half the hospital beds that is the provincial average.
Knowing what you know now about this virus, about the pandemic, and looking back at the year, is there anything that you would have done differently?
As you recall, at the beginning of the pandemic, parks were shut down. Tennis courts were shut down. And with the retrospective of knowledge, there wasn't transmission in those settings. And so we could have had parks open for kids. We could have managed those restrictions more prudently. The mayor says social gatherings are down 95% since the start of the pandemic and aren't a significant problem right now. In 2021, he's looking forward to an effective vaccine rollout to get the city up and running, and says he's hopeful that the measures right now are only temporary. For City News, I'm Yazdani.